Hello, I'm Dr. Angela Meridian from the Meridian Smile Boutique in Syosset. And as you know, we have had to close our doors for about 2.5 weeks now. We're unable to treat patients. And one of the things that as I'm sitting and kind of reflecting on what's going on around the world and what can patients possibly do to try and prevent some simple dental emergencies, I think at the moment we really need you guys to take care of your mouth and really take great care when you're eating and chewing so that you don't dislodge and you don't break teeth at the moment, since we're really not going to be able to fix those for you until, well, we just have to hang in tight for a couple of weeks. It's all going to go away. But in the time being, you know, you always have, of course, to call your dentist in case of an emergency. But for the most part, your dentist is not going to be able to help you at the moment. So one of the things that I think we can do is probably eat slowly and chew carefully so that we can prevent breakage of some of the fillings that are a little larger and have thin part of the tooth there where they can just break off. The other thing is, if you have a night guard, you might want to start wearing it now to, again, prevent any potential damage at night when you're sleeping or stressing out. So this is the time to possibly start to wear that. Eat soft foods. You know, not too sticky as to not to dislodge fillings, crowns. At the moment, it's just not going to be a good idea to have a dental emergency right about now. Of course, you're going to brush and floss. I would floss carefully, put the floss through. You don't want to pull up. You don't want to, again, cause any damage to any existing dental work. So you know your teeth. I would be very careful. If there's areas that feel a little not too strong, I wouldn't push it. Just kind of hang tight until we can get back there and fix everything that needs to be done. I would use a fluoride rinse to minimize cavities. If there's any dental work that comes out of your mouth, whether it's a filling, a crown, anything that comes out of your mouth, definitely hold on to it. There's a temporary cement that you can buy in a store, and you can try to glue your crown back in. I would definitely try to put it back in, because at this point it might be a while before we can get, you know, your dentist can get to do it. But you can certainly call your dentist. They should have an emergency number, and you can tell them what's going on, and they can decide, you know, is this something that's an emergency or can it wait a little while? Even a filling, at this point, you may have to kind of put it back in with temporary cement. There's also a temporary filling material that they sell in the pharmacies that you could try to close a cavity temporarily if it's causing any discomfort at all. If it's a mild discomfort, you're going to call your dentist, but potentially if it's not a very major discomfort, we may have to, again, hold off until all of this is done. This COVID-19 crisis has to end in order to stop the spread. So we're all in it together. I hope this helps. Of course, if you have any sensitivities and sensations, I forgot to mention, I would avoid chewing on that side. Whatever type of food is making it more uncomfortable, avoid it and just go on the other side and try to minimize any chewing on the tooth that's bothering you at the moment. If you're having severe pain, swelling, call your dentist. They must have an emergency phone number for you. Of course, you can always reach me if you need to, Dr. M. Smiles at optonline.net. And this is once again us. We hope you stay safe, and we hope to see you smiling soon. Take care.